Morning, everyone. Dr. FJ, Q&A, Schofield Chiropractic Training. Got a couple questions here. So, first one, I'm wondering if you keep setting realistic goals but don't get them, or things even keep getting worse, what do you do? Oh, I love this is like my favorite topic of all time. Um, so you're so I don't know exactly what's going on, but this is something I talk about a lot with doctors. I talk about it with my kids. My son was last year wanted to hit 500 in his little league baseball, and then we didn't touch a bat all winter, and we still didn't hit that much in the spring, and then he didn't hit 500. So I'm like, we're not setting goals here, we're setting wishes. So I think you got to look at what are the barriers to you hitting these goals. So whatever they are, I'm sure it's some kind of collections, volume, new patients. And I mean, if you're one-on-one, I'm happy to do a call with you. If you're not one-on-one, if you were open to like recording a call and we could keep out specific numbers, I'd be happy to do that with you too, just for so there's some exchange of value. But uh yeah, and then so you're obviously not taking appropriate action is what I'm trying to say. That's all it is. So if you're averaging 5 new patients a week, you want to get to 10, what are we going to do? And maybe you don't know what to do. That could be. So there is some technical, like you could be hammering social media, um, but not doing it in a way that where it works, like you're doing 2 or 3 posts a day, which is great, but you're you're not doing anything that's going to actually drive people into your office, which I see a lot of. And I was the one that said, make it educational, make it fun, funny, entertaining, or inspirational, right? But if you need to drive, I think the educational and driving a niche is where you got to hit with social media, and then you can throw in the others here and there. Um, because me making someone laugh on might get some views and some shares, but no one's going to pick up the phone and be like, hey, I've had migraines for 20 years, come in and do a plan. Um, and social media has changed a lot the last few years. So anyways, it could be maybe you just don't know what to do, but most likely you're just not putting in the appropriate action. Like you want to grow by $20,000, but you haven't raised your fees in 20 years. Or your plans aren't appropriate, or your new patients aren't getting you there. So that's what I would do is just take a good hard look at what are the barriers? What are we doing? What do we need to change? And then you got to go do it. Um, and I get it. Paid media isn't hitting like it used to a few years ago. The newspaper worked for me for about 12 years, drove in 10, 12, 15 new patients a month. It's awesome. And I was spending like $900 a month for 15 new patients. Like no brainer, do that all day long. And then all of a sudden in 2022, my newspaper guy comes and just says all these big companies pulled their, newspaper, their print marketing funding, and we got to close the Sunday paper. Gone. 15 new patients, 180 new patients a year, gone. Now you got to fill that. So that is essentially, you just got to take a good hard look at what's holding you back. It's usually new patients, almost always, unless your plans are just way too short term. But if you're telling people what you think you need, you're doing like a good 20 plus visit plan, you're charging an appropriate fee. So at the low end, probably 45, 50 at the very lowest. At the high end, you want to get to 100 or more, 150, 200. And it depends on what you're doing, right? So that is what, and things that you got to just correct course. In February, the number of new patients was fine, but the amount of commitments was way down. And that's when if you follow me on social media at all, you probably saw I've hammered dizziness, vertigo, POTS. I've just migraines. I've gone hard on that niche because no one in my town, there's 2 people now in my area. I mean, when I first started doing decompression, no one was doing decompression around here. Now there's 2 competitors, one like literally a mile from me, and the other were just down the road in a different town. So, but there's no competition. There's no upper cervical guy, I think, in the whole state of Wisconsin hammering dizziness, vertigo, POTS, brain fog, all that stuff, dysautonomia. So I've been just hammering that on social media. My new patient number is about the same, but the quality of the new patients is completely different. And they're coming in and like 70% plus are doing a plan. So that's the kind of thing. It's just, are you taking appropriate action? If you are, then you don't know what to do. And then you need some outside help. But if you know what to do, then you just got to do it. You got to raise your fees. You got to do the plan. You got to get the new patients. And I will say, organic social media on the average is not done very well in our profession. Um, I don't see any companies really doing it that well. There's a huge opportunity if someone wanted to do that. I just right now don't want to do that for people. I'd rather adjust people. But so yeah, I hope this helps because that is a frustrating place to live. Hopefully you're just not taking appropriate action. If you're working really hard and doing everything and it's not working, just message me and we could have a chat and we'll help you prioritize and then get to work. All right. So short-term treatment plans, how do you handle the re-exam and further visits? So there are no re-exams with this unless you're maybe billing insurance or something. But I tell people, listen, it's your body. I'll do what you want. But you're probably going to be unhappy with the results. And at some point, it's probably not going to work anymore. And unless you do every week or twice a month for the next 20 years, that maybe would be enough to prevent the wear and tear and decay, but probably not. So it's going to keep degenerating. And in 10, 20, 30 years, you're going to have a much bigger problem because we never stabilized it or corrected it or whatever language you want to use in your office, depending on your techniques and beliefs and all that. So then, but listen, we'll go 4 or 5 adjustments. And if you're responding well, great. And we'll go from there. And then they just pay full fee. If they're enjoyable to take care of, I'll do it. And if they're getting decent results, I'll do it. Now, if we go 4, 5, 6 adjustments, they're not responding at all, I will try to talk them into either coming in more or doing a re-x-ray. And this is where you got to decide. Is it just they don't trust you and they don't want to spend the money? Do they just not have the money or the time? If that's the case, you could maybe consider doing a case study video where they let you videotape everything. They give you a Google review, a Facebook review, a video testimonial, and then you can maybe, you can do one of those a month. It's a lot of quality, valuable marketing material, and you can maybe give them an increased discount on the plan to do that. You can't do it to everyone, obviously, but here and there for people who can't afford it, you're getting an exchange of value. You're getting some stuff you can really use. And so you can consider that. But yeah, short-term treatment plans are literally all about pain. And I tell them we're not going to do any re-x-rays. We're not doing any real structural change here. So I will go off some of my objective findings, tension, range of motion. And then it's going to be how you're feeling. And if you're happy with the results and you're getting improvement, then we can do this for you. If it's not, then we need to reconsider maybe coming in more often or doing some re-x-rays or and whatnot, doing that. So, but yeah, there are no re-exams. It's all by how they feel. So I'll usually start twice a week, if they're per visit, if they can swing that. If it's a money issue, it's just what can you do? Once a week. Okay. And I literally let them kind of tell me how they're feeling and what they're doing. I'm in control. They're not telling me how to take care of them, but how often they come is a little bit up to just what they can afford and what they want to do. And again, if they're a pain in the butt, then I'll send them somewhere else. It's not worth the $100. But if they're enjoyable and they understand that like they're not doing what I recommended, they're not trying to tell me how to adjust them though, then yeah, it's just let's start twice a week and let's go from there and we'll see where we're at. With me, my x-rays are really expensive. So that's lots of times what they do that to try to avoid that cost initially. And then if they're not responding, I'll try to talk them into a re-x-ray or whatever. But yeah, and then I just literally go by there twice a week for a couple weeks. If they're still, and after 2, 3 weeks of that, if they're not responding, then we'll have a chat. If they're doing okay, then we'll go to once a week for a few weeks. And then if they're feeling pretty good, it's pretty much on how they're feeling. Then I'll try to get them down to twice a month or once a month. And I try to keep them there. Usually people will just stop once they feel good and they'll come back. But they're coming back to me. That's why my reacts are huge. And they'll refer to me. And a lot of those referrals do plans to, so you just have to make sure you're taking care of them in a way that if someone else comes in and wants that way, you're happy to do it. You know what I mean? So you don't want to be taking care of them, and then they send a referral in, and that's why you don't want to be discounting your fees because then they send a referral in, their buddy wants the $28 adjustment, and you're like, I don't want to do that. But if they're paying full fee and you maybe say, okay, I'll do a re-X-ray on the house for a case study, that's different. And if their friend wants the case study, you're like, well, we do one a month. So, your friend can come in next month. So you control it. You don't want, obviously, you can't have everybody doing that, but one a month gets you a lot of marketing content. So that's how I do it. There are no real re-exams. It's 100% based on how they're feeling. I know a lot of chiropractors say, oh, I don't want to talk symptoms. Oh, it's just all based on how they're feeling. And yeah, twice a week, go for a week or two. If they're feeling some improvement, we go to once a week. Feeling some improvement, twice a month. Feeling some improvement, once a month. And we just, and then, some will stay once a month for a long time. I've had a few really, really good patients that have done the kind of per visit as needed. But, the most they'll drop out and come back in 4 or 5 years. And then some eventually, I've had a few, just had a guy, Chuck. He's kind of been a pain only guy, and he finally, it wasn't going away, and he did a plan. I said, well, we got to get you in more regularly. We got to do some other things here. And he did a plan, and he's been coming to me for like 12 years, just 2 or 3 adjustments, and he's gone again for a year or two. So that happens. It's not the majority, but it does happen. So yeah, just there's no re-exams. They're paying full fee for everything. And you can do, I would say just start twice a week for a week or two and see if they're showing some improvement, go to once a week for a week or two. They're showing some improvement, go to twice a month, showing some, they're doing okay, go to once a month or keep them at twice a month. That's kind of nice. Keep them twice a month for a long time. You're getting a good fee for your adjustment. They're happy. It's not ideal, but again, they're your patient. And in a small town, in a big city, not as big a deal. In a small town, I think not doing this is crazy. Big city, not as big a deal. You're not going to get as many referrals. So if you don't want to deal with these per visits, then just say, hey, I focus on corrective care. You can go down the road. I wouldn't do that your first 5 years in practice, 3 to 5 years, but once you're pretty established and your marketing is good, you could do that. But a small town, I would always, always do per visits because they'll come back to you. You'll get a lot more regularity. You'll get a lot of reacts popping in every 3, 4, 5 months, paying you full fee. You get a lot more referrals doing it. So I think in a small town, you're crazy not to do this. But big city, you can just, it's up to you. So I hope that helps. Any other questions, please let me know. Appreciate the questions. It helps everyone if you have the confidence to put yourself out there. And you can keep it anonymous. And again, if you want to set up a call or you want to hop on this and do it live, it helps me kind of understand your situation and where you're at. And I think you'll get a lot more value from it. And then it helps a lot of other people too, because so many people have the same questions. They just don't have the guts to ask. And again, you ask enough questions, eventually you're very, very, you know what to do. And you got the knowledge and the skills, and then you got to go do it. So again, I hope this helps. Everyone have a great month, and we'll see you in a month, and keep charging.